Looking back on my life as a surgeon, I'm 66 and I'm sitting here in my bed. No, I'm not dying. I'm still in good health. But just looking back on my life as a surgeon, I first graduated in 76. So it'll be 44 years ago, and I've been a surgeon for 26 years. So what's happened over that period and how do I feel about it as I look back? Well, going through med school was just great. Learning medical science, pharmacology, the effects of drugs and how potent and useful they were. Learning pathology, the basis of disease. Learning anatomy, physiology, how the body actually works. And of course, the thrill of going into an operating room for the first time to see the body opened up and what surgeons were actually able to do. Just absolutely amazing. And then when you graduated, being able to put all these things into effect, saving people's lives, someone with pulmonary edema, fluids coming out their mouth, about to die, and you give them a shot of Lasix or a small amount of morphine, you're able to bring them back to life. What a potent power you had in your mind and your hands to save people's lives, saving acute asthma attacks, doing CPR. So it's just wonderful going into clinical practice as a young doctor, delivering babies, of course. And then later on, when you went into your specialty training, in my case, orthopedic surgery, it's great to learn all these surgical skills, both for fixing people after terrible motor vehicle accidents where I had multiple fractures, multiple limbs smashed up, pelvis, arms, and being able to put it all back together. What a great skill and a privilege to help patients who are so compromised and dying and potentially crippled for the rest of their lives that you could actually put them back together like Humpty Dumpty. Then, of course, elective surgery, people extreme pain, worn out hips and knees, shoulders, being able to repair them, putting new implants in. It's like it's really being a bioengineer, putting new parts into the human body. It's a great privilege to have those skills and to be able to help people. And then later on now, I'm doing less clinical work, but going into new areas such as medical, legal. So it's not all over yet. So how long will I go on? Well, officially 3 more years, but the truth be known, I'll probably just drop off the perch. But what's been the downside? Well, the downside, of course, has been exhausting at times. Time away from your family, you shortchange them in many cases. Dealing with administrators, brainless coots, if I'm going to fraction your training, trying to tell you how to do things, you have to take a leadership role as a surgeon, take responsibility, and they're actually trying to tell you how to do it. It's only in daylight hours, of course, they're never around at night. Dealing with endless administrative rules that bear a little resemblance to reality. I've also seen terrible things where administrators have driven young doctors to desperation and suicide. So the other downside of it, burnout, you do just feel exhausted at times and feel like just giving up. That's to be expected given the long hours and the pressures that you're under. You got to keep pushing on. It's incredibly satisfying. So looking back, would I do it all over again? Yes. A firm yes, I definitely would. It's been the most enjoyable career, a great privilege to have been allowed to have done it. And I'd recommend it to anyone. And I'm going to just keep on going. Thank you for listening.